Thank you for being here in this talk, in this conversation that we are going to have as if we were face to face, you and I, just like we are doing right now, explaining everything related to bariatric surgery. We are here to provide you with complete and detailed information about what a consultation entails. First point, patients always wonder if they will be candidates for bariatric surgery. To be a candidate for bariatric surgery, which is a significant medical procedure aimed at weight loss, you need to have an excess weight of at least 18 kilograms above your ideal weight. Not all patients need to have extreme obesity in order to be candidates for surgery, in many cases. There is a notion that this type of surgery is indeed for people with very significant obesity, but that is not the case. There are currently several tools available to us that allow us to not only know your weight or your body mass index, such as in other metrics, in a very precise manner with the help of advanced technology. There are very valuable and extremely powerful tools that will allow me to determine your fat percentage during the consultation process, which is very important. For example, there are patients who might typically have an average body mass index of generally around 30, which would classify them as grade 1 obesity if it were based on body mass index. But with these tools, we can now truly know your fat percentage. What are we interested in? Why? For example, there are patients who might be, imagine people who are super bulky, very muscular, those who exercise a lot. They might weigh 100 kilos, but because of their height, imagine they are 1.70 meters tall and weigh 100 kilos. If we categorize them by body mass index, that patient will fall into the obesity category, but that's not the case when it's a very muscular person. That's why that patient will never need any surgery ever. Why? Because what they weigh is muscle, not fat. That's why we need to know the percentage of fat with these devices. Now then, knowing that not only people with extreme obesity can be candidates, what do we expect to have in an evaluation or a consultation? Many patients believe they need to undergo a procedure known as a gastric sleeve to help with weight loss. Most of them indeed consider the gastric sleeve, perhaps because it is somewhat trendy and very popular. Indeed, the gastric sleeve is an excellent surgery, but be careful, not all patients will be candidates for a gastric sleeve. I'll give you an example, for instance. The gastric sleeve makes your stomach more compact, but only your stomach. I won't do anything at all to your small intestine, which is where we absorb our nutrients and where the metabolism of what I eat actually takes place. So, for patients with a gastric sleeve, we will only use your stomach to make it smaller, making you feel full with less food, sending signals to your brain, telling your stomach that we are full and no longer hungry. A gastric sleeve, in addition to having that mechanical effect on the part of the stomach that we remove, involves a hormone called ghrelin, known as the hunger hormone. When I remove that segment of your stomach, your ghrelin hormone will decrease, and that craving you have to keep eating. For instance, when we have dinner at night and eat well, but still later at night I say, well, I think I want a cookie, a glass of milk, or some cereal. That hormone is very elevated in those patients because they really don't feel full. They keep feeling hungry, for example. But a gastric sleeve, for example, in patients who suffer from reflux, meaning that a lot of acid comes up, understanding a physical principle that with a smaller diameter, the internal pressure will be greater. What happens if I make the stomach smaller and that patient already has severe and persistent reflux? I will make the reflux even more pronounced in those patients. That's why those patients who intended to get a gastric sleeve may not, in fact, be the best candidates for a gastric sleeve, and we actually have to offer another type of procedure. The intention of bariatric procedures, let's call it bariatric surgery with various types of surgical procedures, is to find the best path to achieve the goal we want with you, to lose weight in a healthy, safe, and effective way. Now then, a gastric bypass. A gastric bypass is a combination surgery where, yes, we will indeed make a smaller stomach, because what we want for you is that feeling of being much calmer, with less food and less anxiety about wanting to keep eating. A gastric bypass is also that, making a small stomach to gain that benefit. But we are also going to use a part of your intestine. In a gastric bypass, we don't remove anything from your body. In a gastric sleeve, I will cut a segment of your stomach and remove it from your body. In fact, we are indeed actually even going to take a photographic image and show it to you so that you can specifically see that we removed that particular part of your body, that part of your stomach. In gastric bypass, what I basically have to do essentially, besides making your stomach small, is what do I also do in your intestine? I am going to explain this from a perhaps not so medical point of view so that we can understand it. The absorption of all nutrients essentially occurs in your small intestine. All of us humans, these living beings, indeed absorb everything we eat in our small intestine. Everyone has a certain percentage of intestine in meters, which can vary from approximately 5 to 6 meters in length typically. And believe me, we have counted intestines in patients with very significant obesity up to 12 meters of small intestine. I will give an example. For instance, an average patient with approximately 8 meters of small intestine, which is their metabolic factor, is where what I eat will be absorbed. How can I promote increasing the metabolism? By shortening the absorption space in total. For example, to perform my bypass surgery, if I have a patient with 8 meters of small intestine, I am obligated to measure that intestine. I will explain why we measure it shortly. I might use 3 meters of that intestine to perform my bypass surgery, leaving 5 meters for absorption, meaning for the metabolic factor of nutrient absorption. Those 5 meters are enough to help with weight loss without causing malnutrition in the patient, because many people incorrectly believe that undergoing a gastric bypass surgery will result in severe malnutrition and extreme weight loss, which is a common misconception. However, this is not true. The bypass is also a major surgery, just like the gastric sleeve, but with its proper indication. There are patients who might have, for example, imagine an average weight of approximately 90 kilos and are about 60 centimeters in height, but they are diabetic and suffer from diabetes. For those patients, bypass is the best surgical procedure they can have to help lose weight and in particular metabolically control their diabetes. Because in the present day and age, bypass surgery is considered the best choice to help patients lose weight, even those who are diabetic, to help them stop using insulin and oral hypoglycemic medications and improve their overall health and well-being. So, not all patients, as we can understand, are candidates for a sleeve or a bypass. We need to individualize the patients. Now, all patients, in addition to the evaluation we are conducting, will definitely need to have complete lab tests. It doesn't have to be an extensive list of tests, but a necessary and safe list of lab tests. Certainly, absolutely. Not all patients need to see a cardiologist, but there is a significant percentage of patients, depending on the patient's illnesses and age, who should, in general, typically be referred for a cardiological evaluation. Now, all patients will absolutely need to have adequate prior preparation from a nutritional and dietary standpoint. A crucial key to the overall success of bariatric surgery is thorough preparation with a well-planned preoperative diet. And all patients after bariatric surgery will also need to have a comprehensive and detailed dietary plan to help their brain and body understand how their surgery will ultimately, effectively, and efficiently work. Why do patients need to make this significant change? Obesity is indeed definitely like an addiction such as alcohol or even a substance. An example of this is when someone eats, they immediately feel that reward of saying, I was anxious, I ate, and now I feel calmer, for instance. The brain is super, it can be your ally, and at the same time it can be your enemy. Why? Because the brain wants immediate and instant gratification, It wants to feel that pleasure and satisfaction right away. Because when someone drinks an alcoholic beverage, for example, they immediately say, "Give me this portion of alcohol right now." And then they immediately start to feel like, in effect, somewhat calm, essentially calm. Why is it that when someone goes to eat a piece of delicious and mouth-watering pizza or pasta or their favorite food, they savor every delightful bite, thoroughly enjoying the taste and texture, and eat it, and immediately the brain, not the stomach, feels rewarded by these things? When someone undergoes bariatric surgery, we need to help their brain start recognizing these elements of satisfaction for better results. That's why at some point, indeed, exercise will gradually have to come into play. Exercise is just as addictive and will trigger indications and substances in your brain, which your brain will indeed love. But it's not exactly the same as exercise. It will take some time. A meal plan will take some time for your brain to recognize it as something nutritious and healthy, something that also brings happiness and beneficial effects to the brain. That's why we always choose either food, substances, or alcohol, and other things to get that reward, such as a sense of fulfillment. That's why we need to take you step by step, carefully and meticulously, in a detailed and thorough manner to reach this goal. The important thing is that if you let yourself be guided and advised in any possible way, that moment, that goal you want to reach, will definitely come eventually, in due time. We just need that calm and patience in the end, ultimately. Now, your surgery has arrived, you are prepared, we have taken all the tests. What's next? What should I expect for the surgery? If we definitely did everything right, we will have a completely satisfactory and optimal result at 100%. It is really a benevolent surgery with few discomforts, performed laparoscopically, with quite small incisions in your abdomen. We are currently also performing robotic surgery, which indeed brings other benefits that we will discuss in future videos in a variety of ways. But the important thing I want you to understand is that this is the beginning. It's opening the door to something new, to something that improves your health in order to truly achieve the goal of bariatric surgery. It's not that bariatric surgery will carry you and take you to the point where you want to go. No, not at all, not in any way. Bariatric surgery will definitely help you. It will indeed push you, but it won't carry you. You are the one who has to walk. You have to make your effort. Bariatric surgery, as many people in the family often say, you are indeed and literally taking the easy way out. It's not an easy and challenging path. It's a unique and different path. It's a journey that you have to walk, that you have to travel and experience, and know that you are going to walk it, but with support. Now, along with your surgery that is pushing you forward, it's like climbing a mountain, but instead of going without support, we provide you with certain poles to help you. We are committed to your surgery and well-being. Please remember that you reached a state of obesity on your own, carefully. We only arrive at the destination with our fabulous creative ideas, but many times we can't get out of a difficult problem on our own. We often need to be accompanied. So recognizing and asking for help is of extremely vital importance, and support is crucial. Your surgeon, your nutritionist, sometimes the psychologist, and other specialists, all the doctors who are involved from here to there with you, and we will be with you as long as you allow us, dedicated to your care and well-being. As for me, if I have patients who come to me every year, and I have patients who have been operated on for many years, I am indeed very delighted to continue enthusiastically motivating, advising, and answering every question of those patients. The truth is that surgery is a lifelong process, a decision to change, to help you improve, and commit to a process that I understand is new and unknown, because we often face what our parents say, what the neighbor or friends say, who don't even know about all this, because maybe culturally those parents obviously say, if my child doesn't eat enough, if they don't eat a sufficient amount, if they don't eat tortillas, if they don't finish the plate, they are not healthy. Nowadays we know that obesity does not mean being healthy. There are patients with obesity who even have anemia. Paradoxically, we wonder how it is possible. If I eat a lot and have many extra pounds, why am I not healthy? Because we definitely know that it is not like that. If obesity meant being healthy, well, imagine, we wouldn't have obese patients with hypertension or diabetes. Note, we also don't want to push patients to the extremes. I don't want a patient to be extremely thin either, actually. We want to understand the concept that bariatric surgery does not mean making the patient extremely thin, which is always the fear of all patients, that they will indeed lose too much weight significantly. That is why indeed the nutritional guide for all patients emphasizes indeed the commitment to gradually commence exercising at some point, because what interests me is that you lose weight by losing fat, not by losing muscle. On the contrary, the goal is to gain muscle, lose fat, and improve your overall quality of life. I really cordially invite you to definitely reach out to us so that this information can be absolutely beneficial for you and that we can have a more effective communication channel. I indeed encourage you to possibly schedule a video call or an in-person consultation at our offices to get all the necessary advice. It's important that we can click between the patient and the doctor, between the patient and the surgeon. It's not just because someone says they operate or has a nice smile that should captivate you to go. This is an entire comprehensive process. It's about navigating thoroughly through who we are as surgeons, being highly qualified, certified, and fully prepared to offer you safe tools, and you as a patient, obviously yes, of course, you should genuinely like your surgeon. You should feel deeply cared for, supported, and secure in what you're doing during this extensive bariatric process, because I tell all patients that with this commitment from us, we are fully committed. I mean, I won't just be your surgeon for the day of the operation. I'll also be your surgeon from before that, and as well. And believe me, time indeed passes, and the patient still keeps sending messages. Doctor, I have this doubt, I have this question, even if it's just to be able to at some point, doctor, I've been operated on for 2 years, look at my photograph, I feel incredible, I feel very well. That's what we're here for, to stay by your side. Come to us truly. The only thing you'll regret is not having done this procedure for yourself sooner. Thank you.